what you think our state of readiness is, either in your communities in Texas that you serve or in Tennessee. Where are we from an infrastructure perspective? Kim, maybe you want to do a quick response and then.
Well, I mean, I can speak from our own provider standpoint. I mean, we've had to be very focused with tying our own systems together within our own networks. You know, we have 162 facilities across the country and abroad, so we've obviously had to make sure networking and infrastructure and all those things are in place. So I know within our own facilities, we're well positioned. But when you start trying to connect those rural areas, we still are very challenged with just broadband connectivity, the pockets of service. I mean, that's still an issue that we're running into out there. So I think depending on what population you're trying to access, you're going to run into different challenges. I think in the hospital settings, I know at least in working with our other cohorts in this coalition, in our own HIE here in Middle Tennessee, we're all about the same place and feel pretty confident where we are from a networking and systems and personnel standpoint. I mean, obviously we need more people, but I think the providers I think they're in good shape. It's reaching those rural areas and tying in some of those practices. That's where I think our challenges are going to lie, and even patients' homes, getting them to access the data as well.
In Texas, similar? Or?
Very similar. There's so much disparity among how far physicians have progressed. We still have physicians who are doing paper billing. So then moving all the way from that to those who are fully electronic and are working with an HIE and are sharing information with a number of other organizations. So the full spectrum is there. And we recognize the need for each of those individuals to begin to participate with the overall community. Texas has so much what we call white space, that area kind of west of the Dallas-Fort Worth area that you have to drive 100 miles just to get to a Walmart. So it's very sparsely populated, both by physicians, by patients, by hospitals. So being able to connect those communities and then to do the referrals from those communities is essential. So that's the next step that we're seeing as important for our state, is to really connect that broad expanse that doesn't have connectivity, as well as those metropolitan areas that have a number of competing organizations that need to begin to share that information. There's a term that we've learned recently called metanoia, which means that you need to change the fundamental beliefs that you have in the way you do business. And so that's what's going to have to take place within the healthcare community, is for the patient safety and patient care, that organizations are going to need to start sharing certain information about the patients so that we can do the things that Brian and I are trying to do with our HIEs, is to bring that information to the physicians and to the caregivers at the time that they need it.
Right. Yeah, I think one thing to consider is there's a wide range of variability of sophistication, especially in smaller practices. I mean, you have practices who initially selected a cloud-based EHR and actually think about good connectivity to the office, because they recognize that if that connection's down, they're completely out. But you still have a lot of practices that have servers inside of the office, and they're often in a supply closet, or along with cleaning supplies and the mops and everything else. I mean, you would be surprised where some of these live, and as long as you're only focused on what's happening inside of the four walls of that practice, which has been the historic situation, not so big of a deal, right? I mean, the server's a little flaky, you go reboot it and whatever. When we really start to talk about real-time exchange, sort of outside of the four walls in a more connected world, there are certainly places that have problems with broadband availability and reliability at the telecommunications network level, but you also have a lot of lack of infrastructure inside of the office to even leverage what may be even available in the community. So I think the industry has a lot of growing up to do, but it's the same way that a physician is not going to open without the appropriate medical supplies or the appropriate examination tables, etc. This is a new tool of being able to practice medicine in today's age. And these are going to be things that are going to be considered the same way that every office lives and dies by their telephone and their fax machine today. I mean, if you sever telephone communication to an office, that is a major, emergency. This is just another one of those levels that's going to be on the same tier.
So I think I know the answer to this, but are all HIEs created the same and or operate the same? I think I know the answer is no. And
Well, based on what eHealth Alliance, eHealth Initiatives has
Right.
said recently, there are over 250 HIEs of some flavor up and running or at some stage in development within the United States, and less than 10% of those are sustainable.
Mm-hmm.
So we know that not all are created equal. We know that not all are performing the same functionality.
Correct.
So there's a wide range of capabilities that the HIEs are providing, and that's the disparity among the markets.
Yeah, I think from, when we talk about, being a technology vendor, we have to be able to support different governance models of our customers. So, multiple, depending on who the customer is that you're implementing the technology for, the governance model may vary, more than likely will vary. So, I think there's obviously the challenge there, and that, there are many, there's different infrastructure that you can look at, whether or not if it's a completely federated type of model, whether it's hybrid or whether it's centralized. So there are all different kinds of architecture approaches that you could take. But I think Jerry's point, going into where the market is really, at the end of the day, is what's going to drive. Is what drives it. So, as far as sustainability is concerned, if there is a business problem or if there is a problem that needs to be solved and it's urgent and pervasive, the market's going to figure out a way to solve that problem. And, what we have seen is that we have seen a lot more interest in large IPAs and in health systems saying, I have got it's a life or death situation for me. It's a business necessity for me to be able to figure out how do I draw those physicians in closer to me. Those physicians are the lifeblood of the hospital, that referral base, continuing to refer those patients in there. So how do I provide solutions to them that keep them referring to me? From a risk management standpoint, or from a risk standpoint, if they are going to go down some type of value-based payment path, if they're going to be taking on risk, they're going to need to have tools that are in place to allow them to help better manage that risk.
Right.
So whether it's keeping frequent flyers, as Kim talked about, out of the ED, or having patients that are having recurring issues, the chronic diabetic that continues to come into the ED, if we can push tools or provide tools through the data that's provided in the HIE out into the provider community, out into the front lines, and better manage those chronically ill patients, we can keep them out of the ED. Again, when we've taken a look at different studies that we have done at Shared Health, through super adopters of our application, we've seen 22% fewer ED visits. And, that can mean real dollars. Now, it can vary, and of course it's going to vary depending on the market, but...
and the experiences in Memphis validate that.
Right.
For sure. So sustainability, I'd like to even get a little deeper into that. So I think there's probably a couple of different ways to create sustainability. One of those would be sort of what you just said. I might be left out of the market entirely if I don't participate. So the threat of losing business is a big one. Cost avoidance, we talked about earlier. What about revenue enhancements? I mean, is there a way to get the community of payer, provider, public health, consumers, and employers to all participate in the HIE and pay for that?
I think that we have to look at all the models that are there, because there are many models to create sustainability. Payers obviously recognize benefit immediately whenever an HIE is put in place. So payers are very proactively looking at how the HIE will benefit them. But from the employer point of view, having employees on the ground working more and not off sick or not causing sickness within the workplace is very important for them. From the patient's point of view, there should be agreement among patients that it's important for me to have my information shared. Am I willing to participate in that? Maybe it's participation through their insurance premiums. Maybe it's participation through their office visits. But then from the physician's point of view, we recognize that will I be left out of the market if I don't participate? So those are all variables that need to be associated with it. Obviously, the hospitals look at this, and Kim was talking about this a moment ago. How does a hospital look at the environment when a procedure that they normally would have done is not done now? That's hitting their bottom line. The CEO is saying, okay, to meet meaningful use and to meet the HIEs and PQRI measurements, we need to be doing these things. And the CFO is going, but wait a minute, that's my bottom line you're working with. So that goes back to that total change in the philosophy of doing business the way we've done it in the past. Hospitals are recognizing. We've worked with a number of hospitals that have said, yes, we recognize that this OR that we normally try to keep busy X number of hours a day may be reduced by 15% if we follow these standards. So, but we recognize that it's for the benefit.
Right. Or the opposite, you might be able to increase your volume because you are the most efficient, highest quality provider. And in an HIE, you would see that transparency and more people would be pushed there.
That's a possibility as well.
Any other thoughts on sustainability?
I think you look to where there's sustainable reasons to do business today. I think you're going to find it where the business relationships make sense, and I think the HIEs that have the greatest chance in the future are the ones that are tying together people that have a reason to do business with each other. If you think about things at a state level, et cetera, providers don't do business with the state. They do business with the people they refer, patients to. They do business with the hospitals that they practice in, et cetera. So, I mean, I think, as who pays changes over time and constructs change, et cetera, all you're doing is you're still looking at where does it make good business sense, and wherever it makes good business sense is who needs to be in the flow of being able to fund these things.
Well, another topic near and dear to y'all's hearts is resources. So we've heard at 3 different sessions already at this conference the lack of talent that is readily available for not only meaningful use, but now we're talking about HIEs, which is another whole skill set that we haven't had in healthcare. So what's the need for consulting groups like yourselves to come in and help facilitate and grow? And do you see that talent shortage as more of a global issue, not just for the providers, but for all of the participants?
Yeah, I think it's absolutely a global issue. There is a because we just talked about it, as a vendor, being able to find the folks that have the skill sets. If we just think about interoperability, for example, the ability to understand HL7. Well, great news is that there is a lot of talent that has been doing message-based version 2.x HL7 type of transactions for a long time. We get into things like version 3 with the CCD, not as much. And those resources are fewer and farther in between. And then trying to find the holy grail of the implementation expert is the person that knows HL7 cold, RE2 cold, knows B3 cold, and also knows ANSI, right? Because as we talked about before, if we can accelerate the HIE and the usefulness of the HIE by loading it with claims data, you need to have people that have that capability. From a technology standpoint, on the development side, I think the good news there is that from a platform standpoint, whether we're looking at .NET or Java, there are a lot of really good folks that have great experience in coding. But as far as healthcare expertise, again, not so much. You know, I think it's across the board, and it's a global issue.
I agree with that. I've been involved in the integration side of the business for about 25 years, and so I understand the lack of technology expertise among HL7 version 3 obviously is lacking. One of the great things, though, is that we have so many applications in the market today that have already been developed, and the need to recreate that wheel is not necessarily there in many instances, where we can partner with organizations that can bring a capability that we might need, rather than going out and creating that wheel again. There's a lot of that capability there, but once again, that goes back to the integration of that application with the core application.
Right.
So
yeah, you got to have the folks that can turn the levers, and
that's right. So
you know,
you have to have that capability as well. There is great lacking of that. There are a number of consulting organizations that do provide very good work, but they are so stretched as far as the demand for their services now that it's very difficult to plan how those organizations will benefit our customers.
So going back to my new term that you taught me today, metanoia, how does the provider get over the trust issue in order to open up collaboration, and or the vendors? Because as I look across the vendor landscape, there's some very specific components that some vendors do exceptionally well and not so good on the other side. So, you know, this to me feels like one of those problems where collaboration is going to be the new norm, as opposed to one provider doing everything.
Well, it's going to come down to from the provider point of view, whether hospitals decide to collaborate and share information, whether physicians decide, competing physician practices decide to collaborate and share information. It comes down to patient care. You know, what do all of the organizations? You know, we look at profit, we look at our success in the market, we look at a number of factors, but it really boils down to providing patient care. And how are we going to provide the best patient care for a population? And the collaboration is absolutely essential, because a patient may go outside of your network. God forbid that patient would actually visit a physician that's not within your network. But you know, what happens if that patient is ill, and we live in Fort Worth? What happens if the patient gets ill in Dallas? We don't want to share anything with Dallas, but the whole collaboration piece is going to be driven by patient care. And if we don't do it as vendors, the private payers are going to force it in the future, because it's going to come down to the payers are going to be the ones who are going to drive how things are going to be done. If we don't take control now, and I'm not being negative about payers, but I'm just saying that if the vendors don't begin to collaborate, the physicians and the hospitals don't begin to collaborate, then it'll be much more difficult for us in the future.
Any closing thoughts on that?
I'll just agree with those statements. Yeah.
Need a lot more, better, faster.
Need a lot more time.
A lot more time. Well, that's great. The last thing I wanted to do is really help the audience understand what resources are out there. What are some of the best resources that people can use to track health information exchanges, meaningful uses, other thought leaders, bloggers that you might follow, those types of resources?
Two that I recognize as being very, very beneficial resources for health information exchange are the National eHealth Collaborative,
Absolutely,
and eHealth Alliance. eHealth Initiatives.
Okay.
Those two organizations do a very nice job of providing non-biased information on the HIE world.
I think from a meaningful use standpoint, obviously you've got your regional extension centers, your QIOs. Those are fantastic resources. Now it's obviously not going to be unbiased, but if you are a health system that has spent millions of dollars you know, with a particular vendor, you know, the vendor community has a wealth of information that's available that we provide, because it's a matter of us being able to do business. We need to educate. So, you know, if you have a vendor that you're comfortable with, that has served you well, absolutely call your vendor, see what type of solutions they may have in place.
Absolutely.
You know, if you're starting from the ground up and looking for something new, you know, I think the two organizations that Jerry talked about are fantastic on the HIE side. Obviously, there are a ton of bloggers, and I don't want to mention one or two and leave out some other ones, but there are some great bloggers that are out there. I think for those of us that are in the business, HIS Talk practice for providers is probably a very good place to look. And then for those of us on the vendor side, regular HIS Talk is a great blog to see what's going on in the community and get a broad pulse of what's going on in the business.
Yeah, I think from the provider side, I think, you know, local organizations, if you belong to an IPA or a foundation that represents your interest in that particular marketplace, I think the average physician at times would be a little overwhelmed even with those resources that we just mentioned, because you know, they're broader and they're trying to figure out, well, what of this affects me right now? Where are my local resources? And so I would, you know, if it's an independent practitioner or small group, I would point to
that point,
to
right? I
those
mean, your local HIMSS chapter, right?
Absolutely.
You know,
I was hoping somebody was going to mention that.
yeah, you know, your local HIMSS chapter is a great place.
So, conferences like this, I think
Absolutely.
more and more as we're spread across the country and people aren't working in a physical office location anymore, conferences become more and more important to share ideas and collaborate, and on that front. So I really want to thank you guys for being on our panel today, and appreciate Kim being here as well. Great opportunity. I also want to thank our sponsors, Dean Smith Partners and the HIT Exchange, for putting this together and for continuing the conversation as we go through this process. So thank you.